Hi, Tony Celzo here. Welcome to the line again. I've got Rochelle Glassman with United Physician Services on, really the most expert in the U.S. on this change in the law, the change in the rules for the providers, for the Obamacare revolution, on really trying to move this country from becoming a fee-for-services healthcare environment to an accountable care environment. And what Rochelle and I have been talking about for the morning here is about how this volatility is creating some very unique opportunity and some very big wins, which is going to be contrary to what most of these providers are thinking right now. And Rochelle, you and I were just talking about, how one of the revenue opportunities you guys created by looking at the law differently and looking at the business differently. Talk to me about what we were sharing off camera.
So we were just talking about a program that we'd put together in a primary care practice, right. I think with 5 or 6 PCPs and mid-levels, and we'd identified through HEDIS, so we're being paid now through the Affordable Care Act on outcomes. So if you have a positive outcome, then you're going to get a financial reward for that. So as we know, it's pandemic here in the United States. We've got diabetes. Diabetes is linked to obesity, heart disease, lots of other chronic conditions. That's
it's
costing.
One of those things that happen. It's one of those leading indicator diseases that causes a bunch of expenses later on in the healthcare cycle. And so if you can get and cut that off from the accountable side, if you can treat that cause, you can solve a lot of lagging other expensive syndromes. Is that right?
Correct. So we've spoken earlier this morning about obesity. Obesity creates type 2 diabetes. If we can reduce the obesity in this country, then we can reduce the chances of type 2 diabetes. We know with diabetes, people can get diabetic retinopathy, and diabetic retinopathy causes blindness. And we all know not only the expense in healthcare, but the social expense of somebody losing their eyesight. And so we look at the client's data. We data mine their clients' ICD-9 codes, their diagnosis codes, to see the types of patients that they're taking care of. PCPs are historically complaining that they're at the bottom of the food chain and they don't make money. And the reason they don't make money, Tony, is because they are experts, and I mean experts, at giving their business away. I don't know any other business in the world that gives their business away instead of looking at, okay, I have enough patients to require a dermatologist to come into my office to take care of my patients 2 days a week. Why should I send him down the road and make Mr. Dermatologist a multi-millionaire on doing procedures and services?
Well, I just want to stop you there because I want to really have our audience hear how they went through this process of getting all of their data in one spot in an EHR or an EMR, and then they've got this, and now you're actually showing them how to leverage this investment they made to create more opportunities for the organization, and then looking at it in a different way to say, look, accountable care is where we're going. We have to figure out how to prevent these people from getting these future diseases, and we can do that and create more revenue for the business. I mean, not to oversimplify it, and that's essentially what you're helping these guys do, right?
That's correct.
Now,
that is correct.
How do they receive that, Rochelle? Is it hard to get them to see this world differently? Are they still fighting to hold on to where they were, or are they starting to progress and see how this can create opportunities for them?
So our space at United Physician Services is in the small to medium-sized outpatient, whether it's primary care, occupational therapy, PT, home care. And oftentimes those smaller businesses and practices can't afford a high-level CEO administrator. So they're hiring people between the $50 and $70, $80,000 range to manage their businesses. And these administrators don't understand the higher level business issues of today and how to utilize actually data that they have at their fingertips to help expand their practices. So when we go in and we meet with physicians and we say to them, not just PCPs, but let's talk again about a dermatologist who's new out of school and he wants to get into business and he doesn't have a full schedule of patients. He can go and work 1 day or 2 days a week, generate additional income and referrals that he wouldn't have had for Mo's or something from another practice. A lot of these administrators cannot think out of the box on how to generate additional revenue. So we'll run the stats. Physicians are visual, so they look at the numbers. We all know what we're reimbursed. We can use Medicare reimbursement to build a business model with assumptions. And so we're able to do that. But oftentimes they see it, but they just cannot, or they don't have the expertise internally to implement and manage these new programs. And so we come in and we do turnkey with them.
I think that's one of the things that I really want our audience to hear, Rochelle. It's like, not only are you coming into these guys that, let's just face it. I mean, they went to school for 10 years, but they didn't go to school for 10 years to study business, right? They went to school to study how to take care of people and how to help them, find health, right? And so they're coming into these positions, and then they're depending on people that don't have a C-suite acumen, and we're not being derogatory on anybody. We're just being real. I mean, they're at the level that they can afford to employ to get where they need to go. They're managers of business. They're not a C-suite kind of player that's helping them get ahead and see the vision of what is the opportunity in the marketplace and what are you creating. And that's what you guys do. You're bringing that 50,000 view level in there to help the organization see the opportunity in the marketplace, but then you're also then giving and putting in a plan and identifying the resources on how to get it done. You're not just a consultant that says, hey, we don't do that. That's not what we do. We don't actually help you do what we recommend. You're actually helping them implement and execute plans. Is that right?
That's correct. And then we also, Tony, to take it a step further, oftentimes have management contracts to manage the program or the practice to make sure, because it's easy to implement something and then everyone's not on board or they get distracted and they're too busy. And so I'm a big advocate of action plans, who's responsible for doing what, with timelines so that there is a level of accountability. Because another thing we see in the physician practice environment is a lack of accountability, because oftentimes managers are wearing many hats. They're HR, they're payroll, they're billers, they're dealing with contractual issues, patient complaints, scheduling, and oftentimes, in all fairness to those managers, they just do not have the time in the day to help grow the business. That's what doctors need to look at. The other misconception with physicians is they think they have a practice. They don't think of their practice as a business. And when you're generating, $500,000, $1 million, $12 million a year, that is a legitimate business. But they don't see that it's a real small business. They say, oh, that's just my practice. And it really is a business and needs to be run like a business.
Yeah, I think that's what the strength of your company is really helping transform that practice into a business. And that's what, getting and bringing that C-suite and that execution and strategy to that environment where there's a lot of volatility. I think that's why you guys have been successful, and that's what's making you grow right now.